Assalamu alaikum. We'll talk today about central venous catheters, types, insertion, modes, and complications. The types of central venous catheter, we can classify them in three main categories. The first category is non-tunneled catheter. Example of those is central venous catheters or PICC line. The central venous catheter, the simple one, can last for 7 to 10 days versus the PICC line can last for 6 months. The tunneled catheter is a long-term catheters that can last for a longer period of time because of their subcutaneous tunneling. They can be externalized, such as Broviac and Hickman, or completely implanted, like Portacat. The third category is dialysis catheter. Again, those can be tunneled or non-tunneled. The non-tunneled lasts from 2 to 4 weeks. The tunneled one lasts from 2 to 6 months. The tunneled catheter, as we mentioned, they can be externalized, where the tip of the catheter can be outside the skin, such as Broviac or Hickman catheter, or they can be completely implanted underneath the skin, such as Portacat, Mediport, or Infusiport. In this picture, we can see example of the simple non-tunneled catheter. They can have one lumen, double lumen, or triple lumens. They are inserted typically in the neck, subclavian, in the internal jugular, or the subclavian vein, or the femoral vein. They have no subcutaneous tunneling, and they can be used for medication, antibiotic, or TBN for a short period of time, 7 to 10 days. The other one is the PICC line. It has a longer tube with a smaller size. They can be 1 to 2 channels maximum. They are inserted in one of the veins, typically the cubital fossa veins, and they tunneled, or they go through the vein, peripheral vein, to the central vein to work as a central venous catheter. They can be used for a longer period of time because of their long tube. The third category is the Broviac catheter, which is another form of long-term central venous catheter. They are long. They can be single lumen or double lumen. They are inserted into the skin, tunneled in the subcutaneous tissue for a good distance. Then it has another opening into the vein up here in the neck, or the subclavian, or in the subclavian area. This long subcutaneous tunnels works to minimize the bacterial growth and migration from the skin entry point to the venous entry point. It has a dacron cuff that sits in the subcutaneous tissue, hold it in place and prevent it from dislodging. The third category is the IVAD, or the implanted port, or Portacat. It looks like this. It has a subcutaneous reservoir connected to a tube that's tunneled in the subcutaneous tissue and goes into the skin. As you can see, the port is completely implanted underneath the skin and has the subcutaneous tunnel goes into the vein. How to access it? You have to use this needle, which is a Hooper needle that has a curved tip, which minimize the injury to the membrane of the port and prevent it from cracking and tearing. The third category is dialysis catheter. As you can see, they can be non-tunneled and used for short-term dialysis, about 2 to 3 weeks, or they can be tunneled and used for a longer period of time, up to 6 months. What are the principles of central line insertion? They have to be under sterile environment. They can be under local or general anesthesia. In pediatric, usually under general anesthesia. You have to watch the aseptic techniques, wear gown, mask, gloves. You have to use X-ray to confirm the position before using it, and typically you'd like the tip of the catheter to sit in the atriocaval junction. As you can see, this is in this chest x-ray. This is the airway, the trachea bifurcation. This is the level of the carina. This is the superior vena cava, shadow of the superior vena cava, and this is where the right atrium. You want the central line or the tip of the central line to sit in this area at the atriocaval junction. So if you can see the carina, you want the line to sit about 2 centimeters below the carina at this level. Infection is a very common complication of central venous catheter, count to about 10% of lines develop infection. 70% of the infection are gram-positive, such as coagulase negative staph or coagulase positive staph. 15% they can develop gram-negative infection, and about 8% they can develop fungal infection, and 70% anaerobes. Source of infection usually the skin during the insertion site or access, or later on from migration, or contaminated solution infusion, or hematogenous spread. If it happens within the first 45 days after insertion, considered early, and after 45 days is late. For tunneled central venous, tunneled or implanted catheter, infection can be classified into local infection or bloodstream infection. Local infection can present with erythema, skin necrosis, or pus discharge from the site of the central vein. It can be with or without systemic signs of infection or systemic infection. The bloodstream infection, on the other hand, can be classified into uncomplicated, where it's only fever and sign of sepsis, or complicated, where the patient can present with severe sepsis or septic shock. Hematogenous spread, as well as sign of complicated infection, can present with osteomyelitis, thrombophlebitis, or lung abscess, and others. In this CT scan, we can see a patient developed lung abscess secondary to central line infection. In this patient developed vertebral osteomyelitis secondary to central line infection. And this CT scan, we can see patient developed thrombophlebitis, again secondary to central line infection. How to diagnose CLEPSY or central line associated bloodstream infection? If the device in situ, i.e. the central line in place, you would like to take simultaneous blood culture from the central line and the peripheral line before starting the antibiotic. And there are two criteria to make the diagnosis. You compare the colony forming unit from the central sample and the peripheral sample. If the colony forming unit was 4:1 in the central compared to the peripheral, this is diagnostic for central line infection with 90% sensitivity and 100% specificity. The other criteria is the timing of the positivity. You want 2 hours difference in the culture positivity between the central venous and the peripheral venous catheter, with 75% and 75% sensitivity and 91% specificity. The other criteria, once you remove the device, send it for culture. If the culture comes back positive, this is diagnostic for central line infection. Thank you.